Across the country, health and care services are treating more patients than ever before, with less and less money. People are living longer, which is good, but they often have several long-term health issues. Sometimes people spend longer in hospital than they need to, or are admitted to hospital when it could have been avoided in the first place. For those using health and care services, it can be frustrating and might feel like the different teams aren't joined up. In North Cumbria, health and care services are changing how they work, so local people are supported to stay well, and if they do become ill, they can get the care they need quickly and in the best place for them. What will this look like? Firstly, we'll be doing more to help people stay at home, stay well and look after their own health. Take Jim, for example. Jim is 78, and after a trip when he was out and about, he lost his confidence and began staying at home. His GP told him about the new Penrith Falls Prevention Group at the local leisure centre. Since joining the group, he has learnt exercises to improve his balance. His confidence has improved, and he has reduced his risk of falling whilst also getting out of the house and making some new friends on the way. Cumbria is made up of lots of different communities with lots of different needs. If you live in Alston, for example, you may have different needs to someone who lives in Whitehaven. We'll be providing more localised services to meet these different needs through Integrated Care Communities, or ICCs. When people do become ill, a group of health and care professionals from your local ICC will work together to make sure they are treated quickly and in the best place. This is called the rapid response and will be coordinated by a local hub. Hospitals are the right place to be for some treatments or people who are very unwell, but there really is no place like home. Home will always be the first choice. So how will this work? Let's look at Elizabeth's story. Elizabeth is 82 and lives in Copeland. She has a lung condition which she can normally manage at home. Her condition worsened following an infection and her husband took her to A&E. She was assessed by the Home First team, who agreed with A&E staff that she didn't need to stay in hospital. Home First contacted the Copeland ICC hub, who arranged a rapid response so health and care teams visited Elizabeth at home. Elizabeth received care at home, including treatment and advice from the respiratory nurse on managing her condition and an occupational therapist so she can keep doing the things that matter to her. Support from adult social care for her personal care needs while she recovered. The hub also put Elizabeth's husband in touch with local volunteer organisations who have given them information about other support that's available. Sometimes a stay in hospital can't be avoided. When this happens, the ICC hub can work with the patient right from the start to ensure they don't have to stay in hospital any longer than necessary. Alan was admitted to hospital with a serious heart condition. He also has diabetes, which he has found increasingly difficult to manage. When he was admitted to hospital, his local ICC hub was informed so care could be arranged for when he was ready to leave. After 3 days in hospital, where Alan received the specialist support he needed, he was able to continue his care in the comfort of his own home. His local ICC knew in advance when Alan was leaving hospital, so he didn't have to stay any longer than he needed. There is already lots of work happening to join up health and care services and make things better for people in North Cumbria, but we still have a long way to go. We believe that the best people to design the new services are the people that use them. Visit our website to see how you can get involved.